Hi, I'm Rena, and I am a cancer survivor. I had symptoms of spotting, and I just kind of figured that this was something with my age, and it was kind of regular and didn't last very long, not very much. And I thought, this is just a regular thing and I'm fine. So I basically ignored it, which was not a good idea, especially since I'm an RN and should have paid attention. I finally went to a gynecologist based on her discussions with something that needed to be pursued.
When I first met Miss Rena, she had been to her gynecologist. Her gynecologist performed a biopsy, which indicated that Miss Rena had endometrial cancer. When I first met Rena, I explained to her that the first step in determining the full treatment regimen for endometrial cancer would be surgery. So most commonly, endometrial cancer is diagnosed at an early stage. Many patients just require surgery and then close follow-up. Being that Miss Rena's cancer was a little more advanced, we added the chemotherapy and the radiation for a more aggressive treatment. Patients like Rena who have a positive attitude do very well during their cancer treatments. Also, Miss Rena has a great support system, and she always had someone there in the clinic with her.
I'm doing great. I am cancer-free. I mean, this is a horrible thing to happen. Given that, it still is the greatest team and place could possibly go. I mean, I loved them. They were wonderful. There isn't one thing bad I can even come up with or imagine with them.
I think the patients of Northern Colorado have a great advantage having Banner MD Anderson Cancer Center here in their own neighborhood. I have an amazing team, both in the clinic and in the operating room and in our infusion center. In the clinic, we have nurses, we have navigators, and I have a team of physician assistants that help me see all of my patients. In the operating room, we have amazing operating room nurses and scrub technicians that help us with all of our surgeries. They're very specialized. The infusion center is a really amazing place for patients to get their treatments while they're getting their infusions and their chemo treatments. They spend lots of time with the nurses in that center, and those nurses get to know those patients really well.
Oh, I love her. I do. I love her. And she always comes in cheerful. She remembers everything that we do tell her. She addresses even some of the smallest details that might be bothering me.
I am so impressed on how she handled her journey. And not every patient has to go through surgery and chemo and radiation, and she did it. And she did it all. And she did it all with spunk. And she's like the poster child for, the way all patients should hope to handle their treatments.